And all my participants, I will need to do some multitasking. No, you don't need to do it. I'll take
Okay,
it.
all right. I can help.
Well, I need some people to the room. But without further ado, I'll take care of it. I'll take care of it. Without further ado, let me introduce our speaker today. It is a pleasure and an honor to host Dr. Christy Noble at our faculty. Christy is the Clinical Learning and Assessment Lead in the Academy for Medical Education in the Medical School at the University of Queensland. Through her work, Christy seeks to foster the development of learners' capabilities to effectively learn through practice. She started her career as a hospital pharmacist, and through her pharmacist educator experiences in the UK, her interest in health professional education grew. Christy has more than 50 publications aligned to her research interests, including practice-based learning, especially in clinical settings, and work-based pedagogic practices, including feedback literacy, and clinical supervision. She has generated more than 1 million in postdoctoral research funding as both chief and co-investigators through several national and international collaborations. Impressive! Thank you so much for joining us and welcome, and the stage is yours.
And thank you for the audience for being here, and thank you for the participants online.
And now it should be the presenting mode.
I think it's here. Oh, sorry.
Oh.
One moment. I should have believed you, so. One moment. You just have a little moment to relax.
Exactly.
Ouch. Share the screen. Yes. Yes. I can't really blame jet lag because Australia is only 2 hours ahead, but maybe I can. Like it's about 6 p.m. Dinner time. Normally I'm home by now. So sorry for those online. Sorry.
No. And now should be this one.
I'm sharing that, but that's
This one. Then you can see.
all right. Okay. Totally. All right. So super happy to be here in Hong Kong and to be amongst feedback friends. So we're doing a little dance, just working out what's going on. But well, I'll get going.
Yeah.
Okay. Right, I'll start back. So, as you said, and thank you very much for the invitation to present and for the invitation to be here. So it's really exciting. What I'm going to share with you is some work we've been doing around thinking about how we can enhance feedback literacy in the workplace. So I know there's lots of great work looking at feedback literacy in higher education. So I just want to share with you some of our insights from what we've learned by working with students in health professions education on feedback literacy. Now, it's tradition in Australia to acknowledge the traditional owners of the lands. And so whilst I'm here in Hong Kong, I would like to acknowledge that the work that I did occurred on the lands of the traditional owners in Australia. And I pay my respects to their ancestors and descendants who continue cultural and spiritual connection to country. And I also recognise those valuable contributions to both Australia, and I think now we're sharing those contributions globally. I think most of you will know that whenever you engage in research, it's a team effort. So I've listed some of my fabulous collaborators there, and I can thank them all a little later on, but that's some of the amazing people I've worked with. Now, in the spirit of reflexivity, I want to share a little bit about me and then to give you a flavour of the perspectives that I bring to our research on feedback literacy. So as you said, I had a hospital pharmacy background. So I was very used to working in busy clinical settings, working with diverse teams, so people from medicine, surgery, and also pharmacists and other professions. So I work both as a clinician in those environments, but also as an educator. So I really appreciate the challenges that junior staff experience when they're engaging in feedback in these busy clinical settings. I've also done a lot of research in workplace learning, so how people learn through and how learning occurs in clinical settings. And the other thing I want to share with you is that when we did this feedback literacy work, initially I was working as a researcher within the healthcare setting. Okay, so I was embedded within the context that I was working, researching. You'll see later, that's been a really important perspective to have and to understand the context that you're working. Now, I know when we do presentations, we often present a very shiny and beautiful picture of all of the work that we've done. But I'm also going to share with you some of the challenges and imperfections in our work and be reflective as I go along. So what I'm doing is trying to, I guess, infuse a bit of intellectual candor into our work. So that's, sharing with you publicly some of the thoughts and uncertainties that we've had, okay? So in this session, I'm going to share with you 3 key messages. So I'll share these messages with you now. Now, the first message that we have is enhancing feedback literacy in the workplace. It holds promise. But through our work, we're starting to unpack and find some startling disconnects. And in reality, that can be really tricky to operationalize what feedback literacy looks like in these complex settings. So that's some of the disconnects that I'll be illuminating. And then finally, our work starts to illuminate some of these disconnects, and I'm going to describe those to you today. So I'm hoping by doing that, it'll give you some insights into where you might want to take your own work further as well. So, enhancing feedback literacy in the workplace holds promise. Now, when I first started to read the papers of, from Dave Bowd and David Carles, I got so excited because I'd been working in this hospital setting and our learners were constantly saying, we don't get feedback, we don't get any feedback. So we had and one particular moment that stuck in my mind is we had a teaching session at the end of the medical intern's year. So they've been working in the clinical setting for a year. We asked them about their feedback experiences. And they said, well, we haven't had any feedback all year. We're like, what? And even as we probe further, really all they could unpack and all they said to us was, well, at best we get good job from our supervisors. And it was confusing for us because we've been doing a lot of work with supervisors. We've been teaching them about feedback and something was awry. And so when I read about learner-centered feedback and feedback literacy, I love the notion that we can be empowering our learners. In other words, we can be educating our learners about the role they can play in these feedback processes in the clinical setting. So when we started to think about, well, how can we improve feedback for our staff and junior doctors and students in the healthcare setting, I first came across this work by Dave Bowd and Malloy. Have you, a little show of hands in the room, but everyone would have heard of the feedback mark too.
Looking at my student.
Yeah. So it's okay if you haven't, because I'll work through the definition with you now, okay? So this concept really grounded our work in the first instance with this idea of feedback mark 2. I'll give you a moment to read the definition. So even if you've read it before, have another read, and then I'll work through some of the features that we found particularly helpful. So the first thing that struck us was, okay, well, feedback is a process. It's not something where it's about information being shot out at the learner, or it's not just a one-way sharing of information. It's actually a process. Second thing that I think is really important to highlight is it's where learners are obtaining information about their work. So they're getting insights into the work that they have done. And they're able to start to see the similarities between what's expected or what's the appropriate standard of that work and where they're at in their work. And the other important feature is that it's about generating improved work. So Liz Malloy, who's written this definition with Dave, talks about feedback isn't feedback until you see an improvement. So it is about generating improved work. So the very idea that this tells us that it's not just about receiving information is really helpful to think about. It's not just about receiving information, it's about engaging in a process in order to improve work. What this looks like visually, and again, this is from Valda Malloy, is that learners are orientated to the expected standards of the work. So I've color coded this in terms of what you would expect educators or supervisors. So the lighter purple is an educator. Then the learner would engage in the activity. So that's color coded to yellow. The learner would make a judgment about the work. And then the learner asks for specific feedback. The educator would then make a judgment of the work, and then together with the darker purple, it's a two-way, they compare judgments, generate a plan for improved work, and finally, the learner then puts that information into practice with the subsequent activity. So for us, that was really helpful to think about, well, how are we going to enhance literacy for our students? So it's firstly, we had a conceptual understanding of feedback from Feedback Mark 2. The second part was then, okay, we now need to think about, well, what does this concept feedback literacy mean for us in this context? In the first instance, I like the sort of clear, crisp definition that Naomi Winstone's given us around feedback literacy. It's about know-how on how to maximize the benefits of feedback processes, okay? So our clinicians are always sort of obsessed with thinking about how can we optimize work processes. So for them, it mattered to think about that's something that they could do to maximize and optimize feedback processes. Now, I feel like I'm at the home of feedback literacy. So how many of you have heard or seen this diagram before? I feel like I could go around the room and just say, what do you know about it? But just for clarity, what we do, and this will be important soon, is that we actually then teach, we've taught our students and our healthcare professionals about this model, okay? So we would go through and say, feedback literacy is about optimizing your feedback processes. And if you're going to be feedback literate, that means that you're developing a skill. And that skill requires you to appreciate feedback, that you're able to make judgments, that you can manage your affect and together take action. So in the way that I've just described, Feedback Mark 2, feedback literacy, that's sort of the evolution of how we started to do our work in healthcare, is that we would actually teach our clinicians, our students about feedback, okay? So coming back to this idea of that enhancing feedback literacy holds promise, I'm going to take you through the study we published in 2019. And in this study, we aim to look at healthcare students' feedback literacy in the workplace. So this is a hospital where we conducted a study. It's a large tertiary referral hospital, and we worked with healthcare students who were coming into that hospital to develop their feedback literacy. And then we also explored how they then engage with feedback in these clinical settings. Does that make sense? So, good for a little feedback. Okay, so the aim of the study was to problematize and address student feedback literacy in that healthcare workplace, but we're really picking up on the learner's perspective. So we had two key research questions. How did the feedback literate students engage in workplace feedback? And then what influenced their understanding and engagement with feedback in the workplace? So it was an interview-based study. But you might think, okay, I've said something about how do feedback literate students engage in feedback. The first part of the study was to actually develop the students' feedback literacy. So what we did was we designed a multimodal learning program for students coming into the healthcare setting. We gave them information in an e-learning module about learner-centered feedback processes and feedback Mark II. We got them to do readings about feedback, and then we had student videos describing how they engaged in feedback in clinical settings. We then had an interactive workshop where we got the students to further develop their understanding of feedback processes. They engaged in role play and scenarios that they'd likely encounter in clinical settings. And then finally, we asked the students to engage in reflective activities when they went on placements. So just to clarify, they did the e-learning module before placement, they did an interactive workshop for placement. Whilst they're on placement, we asked them to complete reflective activities about their feedback experiences. Okay. So that's the suite of activities that we engaged in. We had 105 students from different professions engage in this literacy program. So they engaged in the program and then they came into our workplace setting, okay? And when they went in, they all went into different departments at different places. So there we had nursing students who would have gone on to work with other nurses, medical students who'd worked with medical teams and so on. Does that make sense? Yeah. So once they've been working on those clinical placements, we then interviewed them about 4 to 5 weeks after their experiences in the clinical setting. And this is how we started to unpack and understand how feedback literate students engage in feedback in these particular settings. So with the interviews, we had ended up interviewing 27 students from nursing, social work and medicine. And what I'm going to do with you now is share with you what we learned about feedback literate students in the workplace. So there's 2 key findings that I want to share with you. Firstly, that students were able to reconceptualize feedback. And secondly, we learned about the different ways that students engage with feedback during their placements. So I'm going to unpack that now. So from us, perhaps the most exciting thing is that students were starting to think differently about feedback. What they told us was that they'd previously thought that their role in feedback when they're in the workplace was a passive role. So a supervisor would come up to them and they would just wait for feedback, wait for information about how they were performing. They saw feedback as a telling process. Now they shared with us in the interviews that they understood that they actually had an active role and that they could contribute to that feedback process. So I'll share with you a quote now. You can see features of this. So you can see features of the students saying it's not about being meek, it's about unpacking if you've been given feedback information, working out what you need to do with it, asking about it, not being annoying or bossy, but finding out how you can get someone to help you, and also finding out who else is there to help you with feedback. So about not being meek. It's also about being given feedback, understanding it, thinking about how you're going to use it, and also finding out who can help. So that was our first exciting finding around learners reconceptualizing feedback. And now I'm going to unpack a bit more with the different ways in which the learners engaged in feedback during their placement. So firstly, the students were putting themselves, what we found is that they're putting themselves in the driver's seat of the feedback process. They're seeking feedback, hunting down opportunities. I'll just share with you a quote now. to show you that. So you can see there the student demonstrating that they were being proactive, they were seeking feedback, they were asking for it, they were getting on and they were doing it. And the other thing I think is really interesting is that actually if they didn't ask, it would stay behind closed doors. But it's actually, if they didn't ask, they can get information about themselves, which can help in their development. So you can see this sense of empowerment that the students were experiencing as a result of understanding feedback in a different way. In terms of managing affect, I think the most powerful finding for us was that by actually helping students understand what effective feedback looked like, it helped them manage their affect. So they were able to apply lenses to, so by engaging in, so let me rephrase it. So by having an understanding of what feedback, good feedback looks like, they could put that lens onto different feedback interactions to say, hang on a minute, that wasn't quite a good feedback moment. So what I mean by that is, let me share with you. So you can see this student is saying, yeah, okay, there were some negatives in that, but it was, you've done with it, you've dealt with it, you're not internalizing it, you're not thinking about it, you're not saying, I don't want to work with that nurse again. What you're doing is you're being a grown up and you've gone, okay, I didn't do that right, I didn't do that, that's fine. Now let's think about how I can move on. So they were able to reshape a situation from this is terrible to how can I move forward, how can I improve? So they understood that feedback was about improvement, then apply that to a particular situation and start to think about, well, how can I move forward? Does that make sense? Yeah. And so finally, consistent across the data set was that students were finding ways to take action. So they were shifting from feedback being behind closed doors to actually getting out and asking for feedback from particular people. So let me give you an example of where we had a nursing student who was working in the emergency department. And she described a story where she became more and more confident. So she first asked her nursing colleague for feedback on how to do a catheter. And then she wanted to get more skillful. So then she asked if she could do a catheter in a child, which is much more complex. So she asked for a more complex task. And then she also asked for feedback from a senior doctor, which was very interesting because she was really going up the hierarchy and asking someone who we wouldn't have thought she would feel comfortable asking. But she was able to become more confident in the way that she sought feedback. So it was really exciting for us to see how once students understood and learners understood that they had a role to play, where they could take that. So that was all pretty exciting and shiny and wonderful. And so we were getting really excited about the power of developing feedback literacy. But I think there were some startling disconnects, and I want to share with you now, and we'll see if this works. Try and do so. But I wonder if you could have a go at the Mentimeter, and also for those online, to share with us what you think some of the disconnects might have been. So I'll give you a moment, and then I will just work out how to share that with you. Hang on, I have to escape out. I'm just doing a Mentimeter, so I forgot to. Oh, do I need to start it? Have you got problems with it yet?
Oh,
We might have to abort that. Can't. I think I'm gonna. It's all right. Maybe we'll do a little around the classroom and maybe if people can pop it in the chat, go that way.
Wonderful.
Okay, let's do that. So, for those online, if you could pop it in the chat and then I'll just, if you want to chat amongst yourselves, what do you think some of the disconnects were? And then I'll just ask yourselves if that's all right. Sorry about that. Again. Getting better. Okay, and you hear me online. Okay, brilliant. Misalignment between, yes. So Anita said there's likely to be misalignment between what the educators and the students perceive as valuable feedback. Super. That is great. Thank you. So that's a good example of a disconnect. What about in the room? And then we've got some excellent scholars.
Well, the first thing that comes to my mind is just the connect between the emotional responses and
Yeah.
intentions.
Yeah.
I've certainly had many occasions when I provide some like feedback that I think is quite neutral.
Yeah.
Students think that it's, for example, overly critical,
Yeah.
critical or very positive. And I think, well, that was actually quite a neutral comment. Right?
Yeah, yeah, yeah. So that disconnect between emotions and where it's going to land with the learner at a particular time, because we don't have that full insight into what's going on in
You
their
can never
lives.
control that.
Yeah, 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 yeah. Any others?
not really enough engagement from the supervisors.
Say that again, sorry.
The facilitators, supervisors, they're not really engaging in this process as much as the students want.
Yeah, so that's a really good point that was made in the room here, is that the supervisors might not engage in the process in the way that the students expect them to. And that is one thing we definitely found, is that we've done all this teaching with our students about what their role is. And actually, we also needed to do the teaching with the educators to help them understand. We're actually encouraging the students to be more active now. Please expect that. Yeah, great point. And some of the other things that we noticed when I did this session at Cradle was that some of the other disconnects were around different expectations. So what the student was expected to do and then what the supervisors expected them to do. There was a mismatch there as well. So thank you for engaging with that as I manage the technology as well. So one of the first disconnects we noticed was that there's a disconnect between making judgments. So in that it can be tricky to make, for the students, it was really tricky for them to make judgments about the quality of their work in a clinical environment. So for example, one way to do a catheter might look different from one educator to the next. So there's lots of different expectations. So for someone trying to learn how to make judgments about the quality of their work, that was really challenging. The other thing is that these were quite junior, these were students in the workplace, and it's really hard for them to make judgments about the quality of work in that environment. So recognizing that learners, particularly at early stages, are going to need a lot more guidance on what constitutes a good performance than, say, a more expert practitioner. So I think this quote by one of our medical students really hammers that message home. The next thing that we noticed, and I think this is really interesting and certainly something to think about from a higher education perspective as well, is that feedback literacy looks different in different contexts, okay? And this poses a challenge for us to help our students navigate these different contexts. So to give you an example of this quote. So for this medical student, it was actually the way the term or the placement was structured. So they would work with lots of different people. Therefore, they would be getting lots of different feedback, different colleagues. So they might see a different person every week and then get different types of feedback. Even on the same task, they might get different feedback. And so that became hard for them to really gauge where am I at, and then also how do I improve. So I think this is something challenge for us to think about, is how do you prime students for these complexities? And I think it's also thinking about, well, how can you encourage them to keep going despite some of these challenges? So some time for some candor. We had, I mentioned the reflective survey, been very limited engagement with that. So I think if you're thinking about these sorts of activities, that can be tricky to do. The other thing was that we were positioned as a health service. So it was tricky for us to mandate or say that students had to do something, because they were coming from a university setting and we were a healthcare setting. Our program was a one-off program, and I think really when you're designing literacy programs, it's thinking about how you can embed them within the curriculum and then continue to scaffold that across the programs. And you've rightly picked up that we hadn't engaged the supervisors. And so I think if you're doing this work, it's not just with the students, it's also with the educators they're likely to work with. And there's heaps of opportunities, certainly from our perspective in healthcare, to encourage students to be seeking feedback from people from other professions. So I think that's a really important area of interest, and also to think about actually garnering feedback from patients. You know, when I did the examination, was I pushing too hard, or thinking about where else feedback moments exist. The other thing I think is we had some amazing quotes and amazing insights, but this was a self-selecting group of students. So I think they were very excited about feedback, and I think they're perhaps probably a bit feedback literate in some ways already. And then thirdly, it was just a single hospital setting. So I think bear that in mind. So as we've engaged in this work, and I'll bring in a little bit of theory about how I understand, it's based on the work by Steve and Phil, and how I understand how learning occurs in the workplace. And this will become important as I share with you our next study. So what we understood is that we did a lot of work in helping students engagement with feedback. So that's why I've highlighted that engagement, okay? So workplace learning theory argues that learning occurs through an interdependent relationship between how a learner chooses to engage with a particular setting based on what they know, can do, value. But at the same time, the ability to learn is dependent on what's afforded to you within a particular environment, okay? So what we were starting to think about was what were the affordances for feedback experiences within the workplace, okay? Makes sense so far? Yep. So what we'd learned was that we'd enhanced the learner's readiness to engage in feedback, but we hadn't fully accounted for the workplace affordances for the different opportunities. So when I talked about navigating challenges, we hadn't fully accounted for those. The other important point is that when I mentioned that they all went to different areas, so again, we hadn't thought about those, each of those different areas had different opportunities for feedback. So this has led us to our next body of work to think about. We need to better understand how we can support that development in the workplace. So, second message is that I think our work has starts to illuminate some of these disconnects, but we really wanted to explore that a bit more. And so the way that we did that is really start to hone down into a single context. So that was one group of learners, so junior doctors or residents we call here, junior doctors working in an emergency department, okay? So that allowed us to just look at one context, one group of learners. So we conducted this study in a really busy emergency department, happens to be Australia's largest emergency department. And a bit like the previous study, the junior doctors weren't happy, they weren't getting any feedback. But we're pretty excited because our previous work said if you start to educate the students and learners about feedback, you can make a difference. So we started to investigate how we could help the interns engage with feedback within that department and develop their literacy. So again, we were looking at, well, how do, and so you can see a bit of a twist rather than starting with educating. We firstly wanted to understand how do they engage with feedback in the emergency department, and then how can we develop their feedback literacy. So the way we did this is use design-based research. Does anyone use this as a methodology, design-based research? Yeah, got a little wave. I really like this methodology in terms of it allows you to solve practical, real-world problems, but at the same time, by engaging in that process, you're contributing to theoretical understandings. So it's a very pragmatic approach, and I think that could be quite helpful if you are working with practical people like clinicians and so on. So I'll just spend a little moment talking about design-based research, just to give you a flavour of what it is. So it takes place in continuous cycles. So you engage in cycles of designing an educational activity, evaluating it, and then redesigning that activity. It occurs in authentic real life settings. So we did this work within the emergency department where the learning normally takes place. But also it's aimed at testing and refining theory. So we're testing our ideas about feedback and feedback literacy, and also at the same time trying to improve feedback practices there. The other thing for us that was exciting is that we brought together educational researchers and practitioners. So we had medical doctors working with us, and you're sharing your ideas across the team. The other thing to note is that the idea is to avoid solutionism. So what I mean by that is jumping to a particular solution to say, I know how to fix junior doctor feedback literacy, let's do a workshop. Do you know what I mean? Like it's about really thinking critically about how you solve this particular problem. So just a little bit about the context. This is a simulation, so not a real patient, so you'll be relieved to know. But as I said, it's a large emergency department, the busiest one in Australia. And the study occurred over 5 cycles. So we went 5 cycles of designing, evaluating, and then redesigning activities. And we worked across 5 terms with 80 medical interns. So it was a longitudinal study that sort of allowed us to watch the effects of the learning program across that year. So in terms of the longitudinalness, so I talked about 5 cycles. And so this slide, and as I work through, will show you the different aspects of a cycle. So what happened was that the medical interns would come into the emergency department and they would be there for 10 to 12 weeks. In the first 1 to 3 weeks, the doctors just went into the environment and started doing their usual work. All we did was try and seek some feedback while you're there. Then we got them to come back and engage in a workshop with us, teaching them again in the same way I talked to you about feedback Mark 2, teaching them about feedback. We had lots of facilitated discussions. We asked them to bring examples of feedback that they'd received whilst they were on their term. They were asked to critique those examples. And then we asked them finally we got them to do this in the workshop, but do their reflective evaluation as well. Then for the rest of the term, we asked them to engage in feedback processes as part of their usual work. And then finally, at the end of the term, we asked them to come back for an interview or a focus group. What we did at the end of each cycle was really think about how we can refine that literacy program. So to give you some examples of the things that we did, as I mentioned, we got them to discuss feedback Mark 2, we discussed with them, but we also asked them to think about, well, how would that play out in the emergency department? So they were coming up with ideas in that session. We're asking them for strategies to how to act on feedback information. We're then discussing strategies to seek clarity on the expected standards, so if they weren't getting that information, how they would go about that. And finally, sharing their feedback stories as a cohort, really to help them talk about how they would manage their affect and then how to generate strategies for that. You know how I said that we should, design-based research is about avoiding solutionism? Well, we jumped straight in with the solutionism. So full disclosure, and I think starting with the workshop, whilst it was a solutionism approach, because we engaged in those multiple cycles, we were able to refine and come back from that and realise what we needed to do. So I'll share with you some of the things that we learned by doing that. And yes.
Are these workshops mandatory for everybody or can it?
Yes, so the question is, are the workshops mandatory? So they were mandatory for the junior doctors, yes. So they have 1 day per week where they would come in and have teaching. So we embedded ourselves into that teaching program. So whilst it was a solutionism, it made practical sense as well. So maybe I'm being a little harsh on what we did. So in terms of research and our data collection, we had 66 junior doctors engaged in it, 55 of them who completed their evaluations. We had interviews with 21 junior doctors, and then we kept reflections after each iteration. So we had a nice sort of suite of data to work with to better understand. So I talked about that. So what we found, and I think this is the power of a design-based research, is in our first workshop, we realized that, you know, when I talked about feedback Mark 2 and so on, it really lacked context and meaning for that environment. So for the next iteration, we really had to embed, well, when you're in the clinical environment, this is what it'll look like. Or they gave us examples. We then also needed to give them, to have actual practical discussions about how you might enact feedback literacy. So that was a really powerful finding for us. Then also, I think the other thing was that it's not all shiny and easy. So really getting the interns to come to us with the challenges they'd experienced and then how to overcome them. They brought up the importance of engaging the supervisors in the sessions. So the department had a shared understanding of how to engage in feedback across the different cohorts. And finally, in the fifth cycle, we realised the importance of getting them to commit to particular activities after they've engaged. So I'm just going to quickly share with you some of the findings and then we can get close to questions. So I think the two key findings is we call it bolstered agency, and maybe Juuso and I can chat about agency at some point, which would be good. We felt that they had more agency in their feedback conversations. And the second part was that we were really able to find that. What was their question?
Apparently the PowerPoint can't be seen in the.
Sorry.
Oh, yes.
Thank you for the feedback. I'm so sorry to people online.
Oh.
No, no. Do appreciate it's the end of the day. So while we're pausing, have a think about questions that you might want to ask so far.
It doesn't share screen.
I know. That one, yes.
Ta-da!
Yeah.
Hooray, we did it.
Sorry.
No, it's my apologies. Okay,
It absolutely is not joke.
I'll learn it, it's all right. Okay, two things. Interns had more agency. And the second thing is we started to learn how the context was shaping their ways in which they engage with feedback. So in terms of bolstering their agency, they were able to initiate the junior doctors talked about being more confident at initiating feedback conversations. They also were able to work with others to engineer the feedback forward conversations. And I'll give you examples of that. Finally, they were appreciating the importance of having a shared understanding so that the supervisors understood as well as themselves what constitutes good feedback. Let me give you an example. So initiating feedback conversations. So this junior doctor is talking about the importance of saying, and in emergency medicine, they work in shifts, so maybe 10 to 12-hour shifts with intern and supervisor. So this junior doctor is talking about the importance of saying, okay, now I know that at the start of the shift, I need to say to the supervisor, I'm working on such and such and I would like feedback on, okay? So in terms of what we learned is that they were flagging that they wanted feedback. So you'll see the model, but we put an extra layer that they were realizing the importance of flagging or initiating feedback conversations. The second thing that we learned is that they were working with their supervisors to make the conversations more forward facing. So rather than saying that was good, and what they were doing was, so maybe they got to that point where the planning for improved work in the conversation, the supervisor might say, good job, keep going. What our interns were learning is that they could say something like, well, what do I need to do to work at a higher level? So they were able to push the conversation towards what do I need to do next? Now, this is the thing, it's tricky, right? Get more experience. So I think there is a disconnect, right? So we can say that this model's great, but I think now, what do we do with that? We have to start to really understand this context and what they're experiencing, and it takes work. So I think for us, that was a really important thing. They were starting to do it, but what do we do next? So the other thing is, whilst the interns were getting more excited and more engaged, they also felt it was really important to that the consultants or the senior doctors understood the feedback process. So they didn't want to be annoying. So what the interns are saying to us is, we don't want to be just interrupting workflow to say, I want feedback, okay? Or we want the supervisors to understand that we will be seeking more feedback. So they really had a lot of empathy and understanding for how the workplace setting plays out. And that they sometimes, being feedback literate, meant not asking for feedback at a particular point in time. Does that make sense? And then the final thing to note is, even though we just focused on one particular department and one profession, within that department, there were lots of different contextual differences. So for example, when you worked on a day shift compared to when you worked on a night shift, there were different types of feedback opportunities. If you worked, they had two campuses, there was a smaller one and a larger one. A lot of the interns talked about the smaller campus being much easier to engage in feedback opportunities. They had different access to different types of supervisors. The other thing, and so what we found is, to kind of summarize all of this, is yes, we had a better understanding of how feedback occurred in these environments. And yes, we felt that the interns had a better understanding of their role in feedback. It wasn't just enough for them to be proactive. What we were learning is that the interns were having to read the cues of the environment, work out when to ask for feedback, how to adjust the conversations. So it's a very tricky, complex setting. So I guess to summarize more succinctly what we learned, and to come back to that theory that I talked about initially, is that what we're finding is that the feedback literacy is being developed through different workplace activities and interactions, and it's a microsocial occurrence. So it's occurring moment by moment, and people are adjusting their expectations through those moments. The other thing is that we learned is that you can't teach everything. Okay, so we tried to teach them all about feedback, but not everything can be taught. A lot of things have to be learned through experience. Okay. In our first study, we'd gotten really excited about getting our students active, constantly seeking feedback. What we've learned from this is we actually need to really think about the context, where the learners are going into, and to be able to exercise judgment about when and how you engage in feedback and for what purpose. The other thing that I think is really interesting to think about is, actually we could probably improve feedback processes by thinking about work practices. Okay, so our interns talked about working on shift with different supervisors every shift. But what if they were able to work with the same supervisor across the course of a term? That might provide more consistent feedback. They might be able to develop a scaffolded approach to their learning. So it just helped us think, it's not always about teaching about feedback. It's also thinking about how you create those opportunities. And finally, I think it's what we've learned is that, so we've talked about one profession and particularly a specialty, emergency medicine. They have a fundamental and different way of engaging in feedback compared to other medical specialties. So I'd encourage you to think about all the differences that occur in work. So to summarize, okay, so targeted and timely learning programs are helpful. What we learned is the importance of having the clinicians present. And I think our biggest thing is really, you've got to understand the context in which your learners are going into, and then start to think about how you can shape the literacy. And finally, it's really helpful to give people practical things to do in the workplace to shape their skills. So, to summarise in one more, enhancing feedback literacy holds promise. And we found some startling disconnects. I think we're starting to illuminate the disconnects. And we really must think about the context in which people are working in to then start to advance feedback literacy in that workplace. So now I've probably gone over. Oh, so my apologies. Today, that's the amazing team that I work with, and then I will open to questions. Perhaps stop sharing. Thank you so much. And thank you to my audience. Okay.
All right. Anyone? I can see that there's no questions in the chat.
Or a little cup.
Because this is focused on the workplace in people literacy. So what are the difference between the workplace, the literacy, people literacy in workplace and compared to school context?
The difference between school context and the workplace. So when you mean school, do you mean higher education? Or?
Yeah.
So I think perhaps one of the fundamental differences is that workplaces aren't designed as learning institutions. So I know that sounds really obvious, but that's not the priority for the learner. The learner's learning isn't the priority, if that makes sense. Whereas higher education is designed for learning and to promote learning. So I think in terms of developing feedback literacy for the workplace, what we need to consider is what's available to them and how can they make the most of what's available and equip them for that. Does that make sense? So, yeah. Does that make sense?
And I guess in the workplace setting, you get a lot of surprises.
Yes.
Whereas in classroom setting, everything's set up, or these are your learning outcomes, and we're gonna achieve this by this activity and that's it. But workplace, you never know what you're gonna get. So I think it's more challenging to have a good system in place to give that feedback effectively.
So Jodie's just said it out for those online. In the workplace, you get much more surprises, and that's it. You can't control the workplace. You can try to do different things, and I think for us, thinking about equipping the learners to engage in feedback in the workplace was the work that we could probably control. But even then, you can see that there's some limitations with that.
We might take one more question, and then close the official session, and then if you want to have a conversation, we can just continue.
Well, I agree, what you mentioned about this affordness of the feedback literacy engagement. If I was a senior doctor in the medical center, I don't think I would be afford to support this students' feedback literacy engagement. There's a lot of these things going on in the hospital. Why should I give priority for these interns and residencies and give feedback? When I have this emergency patient. So what would be the sort of kind of suggestions to improve that affordance of the engagement?
So the question for those online is what were the let me just read. So it's thinking about the affordances and how we can shape the affordances for feedback opportunities, particularly from the supervisor's perspective. So one of the things I would say, and I was talking to Jodie about this, is that if you think about that setting for the senior doctors, what matters for them is to have a well-trained junior doctor who they know can do their work. So, and we know that feedback is a really powerful way to ensure that we enhance performance. So to give you an example, I worked with a clinician who realized that if she used the feedback Mark II model in the way that she gave feedback to her interns, they got better at some of the tasks she needed to do there quicker than if she'd used a more traditional model of feedback. So I think part of it is actually helping them see the power of, if you use an effective model of feedback, you'll have doctors who can be stronger members of the team and help you more. So that I think is one affordance. The other thing is certainly within medicine, they're very interested in educating their juniors. So they are quite interested in how to do that. So I have found that they do engage in these sorts of activities and want to learn more about feedback. But you're right, there might be moments when there's a big trauma where they're like, this is not the time. Yeah, yeah. I don't think I've fully answered your question. Yeah. All right.
I think it's time for us to close the official session. It is over 5 already. So thank you so much, Christy, for
Thank you.
joining us.
Thank you. And thank you to those online. Yeah. All right, cool.
I still have like 15 different questions, but.
Okay. Thank you, Zooms.
Thank you, Susan.